us have these all the time, right? So if anyone in here has ever had any dental work done, then there's a good chance that you can put on these cool little space masks. My daughter, just the other day, actually had to have her baby tooth extracted because she had some cavity activity and the other tooth was coming in behind. The dentist was just like, well, there's no need in really trying to cap this, spend the money, and 2 months from now the tooth's going to come out, so she had to go in and get it pulled out, and then my daughter thought she could fly. So basically, when you put that on, it makes you feel funny. So she's like flapping her arms like a chicken. I don't know. But the truth is, it's a very safe drug. It's a very safe drug. So how do you give it?
Usually inhaled.
It is inhaled, and it is given titrate to effect. So you start low, and then you increase the dose until you get the therapeutic effect. The therapeutic effect is what? Till they're telling you funny stories?
They're laughing.
Until they're
They may start laughing.
until they're not conscious.
Until you're actually not conscious. No. You're not shooting for unconsciousness. But what you are doing is you're trying to alleviate pain. It is used for pain, right? So I will tell you this. At one point in time, this was pretty common in the field to have bottles of nitrous oxide out in the field. Then there was a period of time, it's kind of like with that conversation we were having earlier, where the broad brush just comes in just like, forget this, people don't know what they're doing. Rather than try to train and teach and be accountable, they just took it all away because paramedics were having too much fun using it in the back on themselves. So now we have come full circle on some of that, and some services are starting to use this. To my understanding, is mostly rural services, which have a longer transport time because this is a safe, prolonged medication to give. Again, the desired effect is to alleviate pain. So what types of pain would you expect them to use this for?
Heart pain.
Chest pain is one. Very good, chest pain. So this is something that you can use for chest pain patients. And what else?
Fractures.
Trauma. Isolated trauma. Not multi-systems trauma. Not a person was hit by a car, flipped down the road, let me put them on some nitrous oxide. No. I fell out of a tree, I broke my elbow, I'm in a lot of pain. Yes. So isolated trauma. Why would you not want to give somebody such a general type of analgesic to an individual that has multiple issues or even just simply abdominal pain, undiagnosed abdominal pain? Why would you not want to do that? Why would you not want to dull their senses?
You kind of need to know what's hurting.
You need to know because at that point you're doing a deeper assessment, and at the hospital they don't want something masking what the problem might be. So you need to understand that this is given chest pain patients that are suspected to have cardiac origin or isolated injuries, okay? And it's titrate to effect. So what happens if you start to see the patient go in and out of consciousness? Because think about this, if the patient starts to go unconscious, what is now your bigger concern?
Respiratory management.
Possibly, but specifically airway maintenance. So now you don't want to cause an airway problem. You don't want to have to start thinking about having to put in an OPA. So you don't want them to go unconscious on you. Now, I will tell you that there is a common side effect. Y'all know what the common side effect is for heightened level, if you will. You got too much. What's a solid side effect that you would see a lot? You know? Nausea and vomiting. And I've seen that. So I've seen it in the dentist office, not myself, but my son. So nausea, vomiting. If you get too high of a dose, it can cause you to be nauseous. Now, what is the remedy for this? Because everything has to have an antidote, right? If we're going to give something, we've got to be able to take it away. Oxygen. Remove it. High flow O2. It will dissipate quickly. So if the patient starts to have some adverse reaction to it, whatever the case may be, take them off, put them on high flow oxygen, and set them up right. Within a very short amount of time, it should dissipate from your system. You'll be able to use it. Now, we don't have any nitrous oxide here at the school, so there's no way I can demonstrate it. Just know this. Here's the final speak on it. So if you find yourself on a service that carries it, know what their protocols are for use, know how they go about their dosing, learn their equipment. Because I don't know of any in the Shelby County area that carries it. So it's always important to know that this is in your scope of practice, but you may not see this in a lot of places. So if you go somewhere they have it, dig into what it is that they require. Yeah.
Are you going to inform us on when to use that versus aspirin and nitro?
So again, this is going to be company based. So this is gonna be more about a place that uses it, where we don't even use it here in Memphis. So if you went somewhere that had it by chance, which is over the state of Tennessee, so there's a lot of areas, and a lot of rural areas, they would inform you on how and when you should start using it. But those are the indicators for use. How they go about using it could be different for each person. Now, you're still not going to avoid, on a chest pain patient, you're not gonna avoid giving them aspirin, you're not gonna avoid the nitro if indicated. Those things are there. But for an advanced level, that's another option for pain management. For us, we give morphine for paramedics. For advanced, you guys have the option to use nitrous oxide. So again, that's gonna be an independent area. Know what your book says for it, for testing purposes. But as for in here, obviously there's no checkoff on it, so we don't carry it. We don't have it here anyways. Any other questions about nitrous oxides? Just something I have to touch base on so you guys know about it more than anything.
Is it in the hospitals, like St. Francis?
I'm sure they have it in the hospital. I don't know that I've ever seen any of them use it in the hospital. I've never seen them use it because they're going to use IV drugs.
Yeah.
If they're trying to manage pain, they're going with morphine, Ativan, Versed, maybe even fentanyl. So depending on what the problem is, depends on what kind of drugs. They're usually not going to use the gas. As dentists, that's about it. Because they want to get you where you're not feeling the pain, but you ain't knocked out because they need you to drive home when they're done with you. Word. All right, let's move on. Let's do this next thing. All right, so let's talk about auto-injector real quick. First of all, who typically would have the auto-injector?
Allergic people.
Okay, people have severe allergies to the point of what? Goes from just an
Anaphylaxis.
anaphylaxis. What's the difference in an allergic reaction versus anaphylaxis?
Anaphylaxis can compromise the airway.
Compromises the airway, it causes angioedema. Essentially, it's life-threatening, right? It's life-threatening because the airway starts to close off and you cannot get any air in, and that is a bad, bad thing, right? So when you talk about anaphylaxis, understand that it is not the same thing as an allergic reaction. Allergic reaction could be isolated, localized. You could have whelps,
Rash.
what?
Rash.
Rashes, eyes watering, etc. I have seasonal allergies. Grass. If I roll around in the grass, man, I'm gonna be itching all over the place, right? That's an allergic reaction, but that's not anaphylaxis. So anaphylaxis is different. There are some things that are common that causes anaphylaxis. Give me some of this.
Bee sting.
Bee stings, ant
Nuts.
bites,
Nuts. Food.
peanuts, shellfish, lots of food allergies, eggs, for that matter. What's another type of thing that can cause allergies?
Plants.
Plants can, obviously. No, I will say this, poison ivy can become detrimental to some people. They have that type of allergy to it. So yeah, it could become anaphylaxis. What'd you say?
Medication.
Medications, obviously. Penicillin is a big one. Aspirin. What'd you say?
Animal hair and stuff or not?
So animal dander and that, some people could have a reaction to that. But typically, we're going to see a lot of food. We're going to see a lot of medicine allergies. We're going to see a lot of animal types, venom injections that are going to be allergic reactions that send you into anaphylaxis. So what's important to note on a patient like this? When you come up, see a person struggling to breathe, having a hard time, you may see whelps, you may not. What are some of the assessments that you're going to want to jump into quickly?
Lung sounds.
Lung sounds, what else?
Respiratory rate, just visually seeing.
Rate.
their-
Inadequacy,
Yeah.
yep, going down that road, yep. You're going to want to do a quick assessment to see if there are rashes that are not visible from walking up. You will want to do, what did you just say? Responsiveness. What about vital signs? What's a vital sign indicator?
SpO2.
Okay, SpO2 could be going down.
Heart rate.
Heart rate could be doing what?
Going up.
Going up.
Blood pressure.
What do you expect the
Going
blood
down.
pressure to do?
I expect it to go down.
Go down, exactly. So it's going to go down. Think about it this way. It's starting to cause you to have a vasodilation. Your body is trying to survive and it's struggling. So what does epi do? What is it considered?
Beta block.
Vasoconstrictor, right? Yeah. So it's going to close that up a little bit, get your blood pressure back up, hopefully open up your lungs, help you to be able to breathe. So epi is the key to surviving. Epi is the key. So we already talked about this would belong to the patient. If you guys remember, in basic school, what did they say y'all had to do with this? So you're going to assist. So I don't even understand what this concept looks like. So the person's passing down and you're trying to grab their hand and then you do another, What the heck is going on? That is some goofy stuff if you ask me. I don't even get that. But now y'all don't have to worry about that anymore. So now you're not going to have to wrestle with the patient's hand to try to get them to stab themselves. You get to take it and jab it. Now, I am going to tell you what the book will tell you, but I'm also going to follow that up with real world legitimacy. The patient gives you this, you've asked a handful of questions, they lead you down the road that they are allergic to these things, they possibly were stung, they're having trouble breathing, maybe they're too weak to give this to you. What are you supposed to do with this before you administer?
Check it.
Patient rights.
The 6 rights, right? Right, patient, time, route, dose, date, documentation. Look, I am not saying don't do it. I'm not saying that. I am saying don't waste time. So if you get this, you can do a rapid assessment on that. I don't want you to be like, all right, no, what's your first name? Where's the date at on this thing? Hang on a second. I'm going to help you. Just keep breathing, for crying out loud. No, let's make this a little bit quicker than that, okay? So let's get to the point. Now, this being a trainer, I'm going to show you the way to do this, right? So it's not going to hurt me. You take that off, right? Hold it like this. Anybody in here seen the movie Psycho? Okay, yesterday's group, not a single person had seen Psycho. I'm losing faith in my young group. Just grab it, jab like this, right? So this is a jab. This is a jab move. You don't want to do this. If you're in a moment of haste, put your thumb over the wrong end. That needle will shoot straight through your thumb. And that's not exaggeration. That's not overstating. They used to have these at the fire academy. And when I would do the demonstration, they had live trainers. And I think I got in trouble for a bit. So I used them all up. But I would go in and I would use like cardboard. And the demonstration was beautiful because seeing is believing. I'd take a piece of cardboard and jab it through. And it would go shoot through the cardboard and then shoot medicine across the room. It's so cool. If you're ever out there, don't do it. Don't talk about it. All right, so you take this, you're going to hold it like so, where your thumb's not over the end. And if you got it on the wrong side, you're not going to mess up. You're not going to mess up by jabbing yourself. And where do you put it? Patient's thigh, right? So just a quick jab, like that. You should hear it click. How long do you hold it?
10 seconds.
10 seconds. When you take it out, what should you do? Sharps container, right? All right, so I'll tell you this about it. Do you have to pull the pants down?
No.
So it can go through blue jeans and stuff, right? Exactly. So you're not going to worry about doing the whole alcohol swab on this. Just going to jab it in there, hold it for 10 seconds, take it out, throw it in the garbage can. I'm mentioning this to you. I'm mentioning. Do not get hung up on this. I have been told, some of these have a multi-dose in it. So there's 2 or 3 doses in one EpiPen. I didn't even know about this until like a year ago. If you have the wherewithal, after you've done this, and the patient is stable enough to talk to, you may ask them, is this a multi-dose vial before you sharps it? And if it is, maybe they can help you reload it. Because I do know that EpiPens are very, very expensive, even with insurance. And so in some ways we do a disservice if we just chunk their other 2 doses they would have into the sharps container. Because you're going to throw this whole thing in.
They would be pretty honored about that.
They wouldn't like it, but in the moment they may not say much because, if they're struggling to live, there's that whole moment there. But I'm only mentioning to you, if you're in that situation, you've given them a dose, take it out, they can still talk to the patient. You may think to yourself, I remember that moment that the guy with the mask on in front of the class mentioned, we should say, hey, is this a multi-dose vial? And if it is, they may have to help you reload it, and then that's okay to do that. And it's okay to reuse their pen again, but I would just say at least use their pen to begin with. You're going to have Epi-1 1000. So should you be like, all right, that's cool, you just hold this, because I'm going to go ahead and draw mine up.
No.
Man, that could be the difference in life and death. Go ahead, use their EpiPen, and then you can think about drawing up your own. That's fine. But use their EpiPen to begin with if they're in a dire situation. What happens if you use it and they really probably didn't need it?
You just spit them up.
Okay. So really just some side effects, right? Increased heart rate, agitation, nervousness. What about if you didn't use it and they really did need it? It could be lights out. 100%. So what I'm telling you is, do your due diligence, ask the questions, know that you have strong reason to believe this is an anaphylactic situation, and then don't hesitate using it. Hesitation can be the difference in life and death. Sometimes some students think that I just I'm a knucklehead because I'm harp on being on time, but I have seen the difference in what 1 minute can make in a person. And this was one of the calls. This is another war story, sorry, but it is a very relevant war story to anaphylaxis. Very, very real war story. Before I start, let me tell you this. Can you have an allergic reaction to something you've never been exposed to? The reality is this. It was very popularly believed that the answer to that would be no. In fact, there was a heavy, heated debate up here at one time. Truth is, there are rare occurrences that a person can, and it is a blood disorder usually that leads to that, where a person can have an allergic reaction. But typically, what is the norm?
You've been exposed to it before.
They've been exposed, and then what happens? Each time, they have a more exaggerated response. So by the time that they're in a situation where they have their first anaphylactic episode, they may be like, yeah, I've been itchy before, or I felt like maybe I had some wheezes, or, I had some red spots, but it never was this bad. That is an indicator that, yeah, your body is now starting to overreact to the point now you could go into anaphylaxis. So you need to think about that, and maybe even get an EpiPen. We have, I won't say names, but we have an employee up here who's had a couple of incidents where it's gotten worse, so now they carry an EpiPen with them. So it is good to know that if you start going down that road, you need to consider talking to your doctor about it. My quick story is this. I worked at as an EMT basic down at Gold Strike, my very first EMS job, right? Had a little EMS room down there. One night we got a call to a lady at the food court who's having difficulty breathing. Took me maybe less than a minute to get there from where I was and walk up. The lady's sitting in a wheelchair. They had her in a wheelchair right out front. By the time I get there, she's talking like, hey, I can't catch my breath. And so she's already having that broken speech. I look and I see that she's already peed herself. I don't know if y'all know this, but if you've peed yourself, that means you are having a hard time. That is anxiety. If y'all know what that anxious look where the eyes are bugging out and you can't sit still, she had all that. So I start asking questions as I wheel her to the EMS room, which was less than 50 feet away. So I'm wheeling her over, talking to her, and she's having a real hard time breathing. But what I'm able to get out of her is she had just eaten at the seafood buffet. She's never had a problem like this before, and she really can't catch her breath. So when I get her in there, you don't know, this EMT basics, we have not a lot. I had oxygen, I had O2 sat, I could get a blood sugar. I did a few of those things, put her on O2 sat, high 80s, could barely hear air movement. So immediately, of course, I call for an ambulance. We have ambulances down, so I call for an ambulance. Within a few minutes, the ambulance does show up. When they come over, they start to take over care. She, at this point, can barely talk at all, and she's profusely sweating. And the paramedic, so I won't talk about the service, and I won't talk about the medic's name, but it was an eye-opening experience, because as a basic, you don't know what you don't know. They come in and they seem agitated that the woman won't talk to her. And I'm like trying to explain. She said the seafood buffet. She's like, was she allergic to things? She said she didn't know. It's like, she can't hardly talk. You see what the O2 says? She looks at the O2 says, she goes, that ain't right. Takes it off. She goes, ma'am, I can't hear you. She takes the non-rebreather off. She's trying to talk to the woman. And within less than 2 minutes, her eyes rolled back. She passed out. She started vomiting. They took her to the floor. I never saw them suction worth of crap. They didn't turn her head. They never gave her epi. This 30-something-year-old woman went from talking to me to dead in less than 10 minutes. She had 2 kids, and that haunted me for a long time. Because there's no reason why she should not have had quicker care. I couldn't do anything more than I did, but the fact of the matter was the paramedic was so arrogant, thinking they knew what was up. They did not progressively go down that road to taking care of business, which would have been epi in this case. I'm telling you guys, don't take anaphylaxis lightly. I didn't know what I didn't know at that time. It took me later when I started learning more. I was like, holy crap, they botched the hell out of that call. Anaphylaxis is very serious. So get it on board quicker rather than later. Now, last thing on this. I have been told recently, some services even carry EpiPens. I've never seen that. I've never seen it, but some students have told me that. I've not heard that from a person at a station that works there that carries them. But if you end up somewhere and they do have an EpiPen, that's not a bad thing necessarily, because that's a quick reference. Because what I'm about to show you how to do takes a second to get set up. So any questions on the EpiPen? Okay, cool. So if you come in and have anaphylaxis, what should you ask them, even if they don't have this set out?
Do you
Do you have an EpiPen? Good.
Do you know there's people that is allergic to seafood that still eat the seafood but carry a lot of Benadryl?
Lord have mercy.
Yeah.
That's,
I found out one of my family members does that.
Yeah.
I can only look at him. Like, do you have the same blood?
they risk it.
Like, I know this is toxic, but the seafood's too good, man.
I've got a story about that.
I wanna hear it.
So I went to fire academy with a guy in Louisiana who trained his body.
Train his body. Is this David Blaine?
No, how to no longer be allergic to seafood. He would just eat parts of shrimp every day until he no longer got reactions to it.
Now, I am not gonna advocate for that, but there is some validity to building tolerance.
Yeah, there's a lot of studies on it right now.
Look, I have read stuff and seen things of doctors out west that take in so much rattlesnake venom to the point that they can get a rattlesnake bite in there. So I've read some stuff. So there is a tolerance built up. I would not recommend it.
Yes. He's just a character though. When he eats
That's
us,
one
he's
word.
always
We use
better.
words. All right, so we're gonna go over how to draw up medicine from a vial,
Was it 100?
and ultimately an ampule. So that's the only thing you're gonna remember. You'll get that wrong in a test. You'll go, but that's what was one. That's what was 100. All right, so this is just saline, but you're gonna use everything that comes in a vial like this the same way. So it's got a rubber stopper on the top. If there's a cap on this, when you take it out of the package, pop it off, that part's already sterile. So as long as you don't touch it at that moment, you don't have to worry about cleaning it. It's not a bad habit if you do, but if there's not a top on there, it's a multi-dose vial, just know you always got to get an alcohol swab and clean the rubber stopper first. Now, how to draw something up from it. So you get you a syringe with a needle, and since you're going to get however much, we're just going to say 1 milligram. So it's 1 milligram, 1 milliliter as an example, just using that. You're going to pull back to 1. So it's 1 cc or 1 milliliter, however you want to say it, of air. You've already cleaned the stopper. Now, here's the important part. Elbows in. This keeps you at the center of balance. If you're out here trying to do this stuff, man, you're just trying to stab yourself. Keep your elbows in, and always use points of contact and a V. So come up at a V like this. If you're coming like this, you again, somebody will be like, oh no. And they're going to back up because they're nervous, because you're scared. Keep your elbows in, V, and I make contact. This way, if I'm in the back of an ambulance, look how much control I would have if I'm bouncing around versus trying to do it this way. You always got to think about movement. And then I just simply put the end of the needle straight into the rubber and punch it in. Now it's in there, so we're good. I shoot that area, and what that does is it charges this and makes it a lot easier to pull back. I'm not even pulling back, and y'all see how it's coming back to me, right? So what I like to do if I'm pulling out of a vial, if I'm getting 1, I'll go past the 1 a little bit and then push back up to the 1. Why would I do that?
Remove any air that's in the syringe.
Going ahead and getting rid of the air, exactly. So now that's ready to rock and roll. Now let's talk about how you give a shot. So that's how you can draw it out of the vial. I'm just going to take that, push it out of it. So giving a shot. First I'm going to show y'all sub-Q. Like I said a while ago, you guys are not going to give sub-Q shots. In fact, I don't know of anybody that gives sub-Q shots. I'm not saying they don't happen, but I know fire departments and stuff now went to all IM, but you still need to understand what a sub-Q is. So when it says sub-Q, subcutaneous, where is that going? Where's the needle going?
Fatty between the
To
skin
the
and the
fatty
fat.
part, right? Just below the skin, not into the muscle. There's that little fatty layer. So what that requires is a 45-degree angle. So this time you are crashing airplanes, right? So you're going to try to go at 45. We use the deltoid as our site. There are several sites you can use on a person that are muscular, but for us, let's just focus on the shoulder because the deltoid's the easiest place to get to, and for most people, this is meaty enough to handle it. Now, if you had some little frail person, you may have to pinch up some meat to get to it, but at the end of the day, most people will be able to receive this. So we're going to use this spot here. I'm going to use your alcohol swab, if you would, sir, so I can demonstrate. So just like with the hand, you take and you're going to clean it good, and then circular motion on your last one. This one too. So you've got it drawn up, right? So I've got a cc of whatever I'm going to give. I always try to make contact low. If I'm off to the side like this is how I'm going to do it. I've got my pinky down here, and it's kind of in a dart form. That way I can go straight at a 45. I'm trying to see where y'all can see this. So I just puncture under the skin at a 45. No, I don't really know a measurement, but just a milliliter or so underneath the skin. And then pull back and then administer. Why do I pull back and then administer?
Charge it,
What's that?
to charge the shot.
Nope. Once I'm in there, what I'm pulling back for is to make sure I'm not in a vein. Because you don't want to be in a vein or an artery. So pull back, make sure there's no blood, then administer. Yesterday the person said, well, what happens if you see blood? Take the needle out, throw it away,
I'm trying it.
try again. Now that's for sub-Q. You will not do sub-Q. Ever. Ever. Just showing you what it would look like. 45-degree angle. Now, same process if you're giving an IM injection. You will give IM injections. Same process. So we got the 1 cc drawn up. We've cleaned it. Again, I have a point of contact. This is a 90. 90, straight in, straight to the arm. So a hole, puncture straight through. You don't want to go slow. You don't want to be like, you're going to feel some pinch. Is that okay? Hell no, they're going to be okay. They're going to be screaming.
Rolling and jerking.
You just want to go straight in to the hub, if possible. Now, if this is a very small, frail one, you got a long needle, you may have to adjust your needle, so pay attention to that. Once you're in, again, pull back first, then administer. Out, sharps container, may have to put a Band-Aid on it. What drugs can you give IM that you can give IM? Glucagon. That'd be what? 1 to 1,000, because you've already started to correct yourself. Good. What else? There's one more thing that y'all actually can give, but I don't recommend, because there's other options for you. Narcan. You can give Narcan IM. Obviously, I would recommend giving it intranasal or IV if you have an IV. So
you do the full depth of the needle portion.
well, you're supposed to, but if you have somebody that has like not a lot of meat, you have to pinch up some, or you may have to adjust. So in other words, it's not like every single time. I mean, like, I'm jumping on board here. You can get all that needle. That ain't gonna be a problem, right? You just gotta be mindful of that. That's all. And when you recap, obviously, the V is a good idea, and then sometimes people set that down like that, and then they scoop it up, so it get caught on the paper. Just don't stab yourself. All right, so we've done IM. Let me see. What was it? There's something else I wanted to do with that. No, we'll practice. We'll practice after we do the FE 1,000. Okay.
Okay, now how do we calculate the amount of epi to pull?
We're about to go into that right now. So you got 2x2, 2x2s. Have I got 2x2s? Oh, good. 1,000. Okay, so this is called an ampule. The dosage and the volume in it is what? You can look at the bottle or the little glass container. You should be able to see this. 1 milligram and 1 milliliter. I know it says sub-Q or IM, but we only give it IM. That's it. No other way, right? So the concentration of it is 1 milligram. What is your dosage for an adult patient? Does anyone know? Y'all looked it up. Well, 1 to 1,000 is what you're giving, but what's the dosage of it?
1
That's the concentration.
milligram per kg.
So no, it does go to a kilogram base for children, up to 60 kilograms. Past that, it's an adult dose regardless. So if you're 12 years old and you're past 60 kilograms, you're going to get an adult dose. The adult dose is 0.3 to 0.5 milligrams. So if you're going to give 0.5 milligrams of this, how much would you give?
Half.
If you give half.
Wait, 0.3 to what?
0.5. And if you were going to give one dose, you could give up to half of this, right? So you could give half on an adult that's having
Yeah.
trouble.
You did say it is weight-based for kids.
For kids, everything's weight-based for kids. Every drug you will ever give is going to be weight-based for kids, except albuterol. So albuterol is just a squirt in there and you give it to them.
Wait, so the adult dose, if you're dealing with an adult, then you're going to give them 0.3 to 0.5 milligrams.
And it's not, it doesn't just have to be an adult, anyone over 60 kilograms.
Okay.
So it could be a kid, but it's going to be a big kid.
Yeah.
It ain't going to be, if it's
Yeah,
an 8-year-old
like
over
my
60
kids.
kilograms, all right, well, all right, but it's rare on that one, right? So,
No, both my kids.
we're over 60 kilograms at 8 years old?
My oldest, I look up to, he's 17.
Well, now I can understand later, but I'm talking about at 8 years old.
But at 8, 9 years old, my youngest right now is 5'6", over 5'6", because my wife looks up at him.
Is he 8?
He's 11. Okay, but he has been over 100 pounds for quite a while. So he's that borderline patient.
There are those examples, and then I will go maybe 0.3 on that one. But the point is, you're going to give half. Now, you give it. Patient doesn't seem to be doing great. How long after that could you give a second dose? 5 minutes. In 5 minutes, you reassess.
Even intermuscular.
That's the only way you give this.
Okay.
That's the only way. How do you do it?
Intermuscular.
Intermuscular. It's the only way you ever give this is intermuscular. Only. You can give up to 0.5 on one dose, and then on a second dose in 5 minutes, if they need it, you can give up to 0.5 a second time. Always only intramuscular. So, what happens if you give this through an IV?
Probably just send them in the shot.
You definitely are going to cause some problems. One, it's pretty hot, so it's going to burn your vein up. It's going to burn it up. Another thing is it can throw you into some cardiac disturbances because it's so heavily concentrated. I know you're going to be used to hearing that they give epi through an IV to cardiac arrest patients, paramedics do. But it's 1 to 10,000. So that is a much more diluted epinephrine. Think about this. Quick comparison, and it makes sense. I don't know if you know this or not, but hydrogen peroxide, if at 100%, is acid. It will burn through probably metal. I've never seen it, but it is very acidic.
I know
You have such an amazingly watered down version of it, which makes it work on cuts.
I think they use it's either 70 or 80% between butcher stops.
And I wouldn't know that, but it would make sense. So my point is,
I'm a hazmat nerd, so
I used to be, but I've given up on so much of that, the placards and such, and North American Guidebook. But what I'm getting at is this is very, very hot. It's very concentrated. Let's say hot, I mean it's just corrosive-like, right? So this is very, very tough. You put this into a vein, you're causing a lot of damage. It has to go into a muscle. Must go into a muscle. Obviously, sub-Q would be acceptable, but we don't do that anymore. So let's talk about how you get the medicine out. All right, so you're gonna get your 2x2. Get your 2x2. You got your ampule here. If you'll look at this, it has a little blue ring around it, right? So that's where it's been scored. That's what it's called, being scored. So it breaks easily. Now, in this little hourglass part, sometimes you get this out of the package, you're going to see that there's medicine in the top of this. Now, clearly, if you pop this top off, you're going to waste that medicine. You don't want to do that. So there's two ways that you can get this out. You can take and you can swirl it, and it'll come down out of it. Or you can do the cool way, like I like to do. So I use cool points. So you're holding the top up, a couple of wrist flicks, and then it should go down out of it. However you get it out, doesn't matter to me. You just want to pay attention to that, make sure that there's no medicine in that before you move forward with the next step. So the next step, you take your 2x2, and it is important though that you do pay attention. This is real glass. This is real epi. If you cut yourself, it gets in your system, you will have real side effects. So it is real. You take it, cover it firmly on the bottom, and you just pop it off the top. It should pop nice and easy. Go ahead, and you can do that now. Just a little good practice on it. See, now you actually,
twist it.
Just a
did
little.
you not get your medicine out of the top?
Pull
That
this
is
out.
called a life lesson.
There you go.
Was it supposed to break the blue
No, I
line?
I got the medicine out of the top. It just
Sometimes
didn't
break the
it.
blue line,
No,
sometimes
that's fine.
break
It's
the
just
close.
scored. Yeah, you
As long as you don't break it in the middle of the valve.
Yeah.
You're a big, strong fella. You're a big, strong fella. Oh, wow. Okay, all right, there you go.
Oh, I thought we had to break it through the blue line. Okay.
Well, the blue line is scored, so it just allows that top part to break easy. Breaking it where you broke it's perfectly fine. Okay, now the next part. This is the cool part. How many times did I blow you off my last week?
8? No.
I think we were up to 11.
Here comes the
Yeah,
first time I'm going to blow your mind today. Everything up to this point has been kind of boring and dry. Notebooks. Yes. Ugh.
I mean, you blew our minds with those war stories, so I don't know if those.
Yeah.
I didn't know that was blowing your mind. But
I
that's
mean,
good.
it's always interesting.
Yeah.
So.
Interesting, yeah. But this is going to blow your mind.
Okay.
All right.
Fair
So.
enough. I'll let you determine what is and what isn't.
Well, you'll determine in just 2 seconds. So this obviously it's just a regular syringe. Now, I will tell you what you are supposed to use. Is a filtered needle. What a filtered needle is basically a firm plastic needle, not a metal needle, to draw this out with. The reason why you're supposed to switch this out to a filtered needle is because of the idea that there could be small little pieces of glass that broke off and went down in there. So when you draw this medicine up, that should filter out the glass. And then, in order to give the IM, you're going to have to take the filter needle off and put on a metal needle. So whatever you take off of this, put the filter needle on, draw it up, take the filter needle off, put the metal needle on, then give the medicine. That is how it's supposed to work.
I feel like it's a lot of risk to lose the medication.
It's a lot of risk to lose the patient if the patient's tanking and you're having to get this. I am telling you how you're supposed to do it, and I am encouraging you to do it the right way, but I'm also backing that up with if your patient's dying, small glass shards in their muscles, not the worst thing they could be dealing with. So, the proper way, the book way, filter needle, take it off, put the metal needle on. Now, once you've done that, here comes the first, that's not the part that's blowing your mind. So watch me. So this right here, you don't want to take it, you don't want to shake it, because it will all come out. But you can easily rotate it, and it will not spill out. It doesn't come out because of the way the vacuum is. So I always would rotate it over. Now I'll say this is when you don't want to charge it with air, because if you do that, it's all coming out. And I've seen that done in scenarios where they're hurrying and rushing, and then they look around like, I'm like, no, I saw it, dog. Go ahead, get your new one, because my eyes be sitting, they big, dog, they big. Don't act like I didn't see that. So you can flip it over, then you're not going to charge it. You put it up in there, and then you just start drawing it back. Nice and easy. You may have to push some air out, go back in again. That's normal. Once you got it all drawn out, push your air out, boom, you should have 1 milligram, 1 milliliter. Draw it all the way up. So go ahead. This time you are welcome to attempt.
Wait, you mean like this vacuums it shut? Like you can tip this up?
As soon as you tip it over, your head's blown. It's going to happen.
Okay, here we go.
It's like a Dairy Queen ice
I
cream.
had so many students yesterday.
What?
Like, they were like, I'm scared. I'm like, scared of what? It's going to attack you? I mean, don't put it directly over your eyeball. That's not going to be a good idea.
What is that whole left hand thing?
And it may take you a few times to practice the idea. Remember the V, so you come in at a V angle.
Bring your elbows in.
So you're not stabbing yourself. That's key. Balance and coordination is a really big thing, and not everybody has that. So understand that. You let me know when you have it
You
all
have to
drawn
be
up.
straight up. And bring your needle down a little bit into the fluid. If you go above the fluid, then you're not gonna really get none.
When I think about how I never had students do this in the past, I cringe because it's so important for your first time to not be on the scene with the patient tanking on you and you're trying to figure out how to draw this up. So I'm glad that my one patient that I joke about trying to jab it through the glass did what he did because it helped me fix a problem I should not have put in there.
It's in
To be
there.
fun.
Hey, if
It's
you're
okay.
not, look, if you guys are getting air, it's because your needle went too far. If
That's
you're pushing
right.
up here, the air is up here. But if you go where the fluid is, put your needle right here. See where the needle is? Ain't nobody looking. Okay, cool. That's where the fluid is at. You don't get nothing if you're up here. You gotta be in the fluid.
Hey, you know what that looks like? That's cool. Looks like when a ghost on Pac-Man.
Oh, cool. I'm glad that's what it looks like. I was about to erase it.
Okay, I didn't quite get a full full CC.
It's okay. It's okay. I mean, if you can't get the whole thing, it's fine. The idea is that you see that it is a little bit challenging, something to work on. And ultimately, you have the technique now. So you have a technique to work with. Because before this, if I wouldn't have showed you and had you do it, you probably would have not had the idea of what you may have to work on.
Literally just getting it.
That's frustrating. I see fluid, but I'm not grabbing. It's not grabbing.
See where I'm at? See, if I go way up here, I'm missing.
Oh, I got so
I have
much
to
in
read.
here.
Right
Now, the
there
one
where
thing you would not want to
the-
do
See how it's sucking it
on
up
the
now?
scene
Because the
is
needle's in the fluid.
continue fumbling
But
with
if you
it.
go up here,
If you
have
got
to
up
bend it
to
here. That's it.
half, you have enough for a dose, go ahead and give that. If you had to crack open another one later, that's okay. So what I'm saying is don't let trying to get every last little thing out of it be the thing that holds you up. Once you get at least to a 0.5, you got enough for a dose. Think about getting that on board.
So this looks about right?
Yep.
What about the air bubble down here? Doesn't matter.
It's not a big deal because remember, this is going into the muscle. It's not a vein. I mean, you try to get them out, but if you shoot air into a muscle, it's no harm, no foul on that.
Oh, you look at mine.
Yeah.
I thought you were leaning over to.
Yeah, so the reason why I didn't want you to throw it now, what we're going to do is going to come around. And everybody's going to practice an IM injection. So, with your needle, you're going to practice, you're going to get, you can stand up if you need to here. Get your alcohol swab, clean it. You go ahead and draw up a cc of air. I'm just going to shoot air into the arm. V up, like that, so that you're not going towards your body. That's it. You don't want to stab your arms. Hands, feet, legs, nose, you don't want any of that.
Knees and toes.
Thank you. You did the song. They good? Oh God. I want to know that.
Ow.
What'd you do wrong? What'd you do wrong? Besides stab yourself. You
I forgot to talk to the patient.
well, that could be one thing. There's nothing wrong with that. What else?
Did you pull first?
Oh, I forgot to,
Pull back.
the charge.
So then if that bad boy was in a vein, you just shot some Epi 1 to 1000 straight up into their heart. All right, let's see what you got.
He's that, so I know not to have a medical emergency.
Don't worry, he's probably one of the best they have.
Oh,
I work there.
so for some reason I never hear good things about Memphis Fire.
You know what? There are some really good things, and I did love my career there.
Alright.
But there's plenty to
There's
talk
gonna be a
about.
big stick now. Alright, 3, 2, 1. And
Oh God.
what do you mean?
All right, 1 cc. Yeah, there you go. That way you have something to go off of.
Alright, ready? 1, 2, 3. Pull back. Not in a vein. Drop.
Very good. Very good. Now you-
Scrub,
Back.
Okay.
1 cc.
Okay.
Got that drawback.
All right. Good.
I am gonna definitely not put this on until I alcohol swab. Off vein, circular, 2, 3, and draw up. Not vein, and then.
Very good. Sharps it. All right. School that we were in school, so she wanted to come to school with me, and I brought her, and we just happened to be the one day that we were doing IM stuff, and so we did a round table, and so we did a round all the way around, people doing the stick, and she does it, and then we're walking away. She goes, "Hey man, why so many forget to clean the site and nobody pull back? You told them that." I was like, "Girl, spoken like a true champ." All right, so any questions on today's stuff? So we went over nitrous oxide, we went over Epi. You understand EpiPen. We went over sub-Q and IM. You know you only do IMs. You had your practice on the IM, so when you go to the hospital, you go to sleep in.